If you have a tooth that is severely damaged, it may be possible to save the tooth with a crown. A crown is a tooth-shaped cap that is placed over a tooth. Once in place, a crown gives added strength and stability to a tooth while retaining a natural look and feel. There are many situations that may call for a crown. One of the most common reasons is to protect a weak tooth. If a tooth is severely decayed to the point where a filling will not stay, or if the tooth structure is weakened, a crown must be placed on top of the tooth to save it. A crown is usually performed after having root canal therapy to restore a diseased tooth. If a tooth is cracked or fractured, a crown may be the only way to protect the tooth and keep it from breaking. A crown can also be used to cover a dental implant or as part of a bridge. Whatever your reason for needing a crown, it's a safe and effective way to restore your smile. A crown is usually performed in 2 appointments. After taking any necessary x-rays and examining the tooth, the first step is to prepare the tooth structure. Your dentist will use a special handpiece to shape and resize the tooth in preparation for the crown. If part of the tooth is missing due to decay or damage, your dentist will use filling material to build up the tooth enough to support the crown. Afterwards, an impression of the tooth is made by using paste or putty. Your dentist might also make an impression of the opposing chewing surface to make sure that the crown will not affect your bite. The impressions are sent to a dental laboratory where your crown is custom made to match the shape and the shade of your natural teeth. Your dentist will usually place a temporary crown at the end of the first office visit to protect the tooth while the permanent crown is being made. The temporary crown is usually made of acrylic and is held in place using temporary cement. The permanent crown is usually returned to your dentist office in 2 to 3 weeks. At your second visit, your dentist will remove the temporary crown and place the permanent crown. After checking the color and fit, the permanent crown is cemented into place. Your new crown will blend right in with your other teeth, and if you care for it properly, it provides long-term protection for your tooth. A crown should be cared for just like a normal tooth. Crowns are designed to last for years, but their lifespan depends on how much wear and tear they are exposed to. If you want to maximize the life of your crown, it's important to practice good oral hygiene. This includes brushing your teeth after every meal and using dental floss daily. Of course, brushing and flossing aren't enough to maintain your healthy smile. You also need to visit your dentist regularly for a cleaning and checkup. Your dentist can check your crown at each appointment to make sure that it is functioning properly. If you practice good oral hygiene and get a professional exam and cleaning done regularly, your crown can strengthen and support your tooth for many years to come.